We're facing a perfect storm, a significant increase in flu cases, a bitter cold snap, and a Labour government. Where does this lead us? To memories of those ridiculous times not long ago when countless people donned face masks as soon as they got out of bed, and some even wore them while sleeping. Talk about a mood killer. Now, that chaos is returning. Hospitals nationwide are reintroducing COVID-like restrictions, mandating that all visitors, regardless of their health, wear masks. With winter flu cases yet to peak, we can expect even more of this. During the lockdown frenzy a few years back, some of us noted that if you supported non-medical interventions for COVID, like masks and social distancing, you would logically need to support similar measures for flu each winter. After all, flu has historically caused thousands of deaths, sometimes up to 20,000 annually. If lockdowns are justified for one dangerous virus, they should also apply to another. Our intention was to highlight the absurdity of these measures. Yet, astonishingly, some naive individuals interpreted it differently, suggesting that we should indeed lock down every winter for flu. With a large state Labour government and rising flu cases, this idea is gaining traction. Today it's masks, tomorrow it could be the rule of 6 and compulsory vaccinations. Forget the fact that masks have little impact on virus spread. Forgetful that in previous winter flu crises before 2020, we never considered making healthy hospital visitors wear flimsy masks. Forget that non-medical interventions were once viewed as far-fetched. We're back to the something must be done mentality. This time, the leader isn't Boris Johnson, who, as revealed in his recent autobiography, felt compelled to take such actions against his better judgment, but Keir Starmer, who consistently advocated for stricter restrictions during COVID and wrongly labelled any easing as reckless. The authorities understand that face masks, whether in hospitals or elsewhere, have minimal effect. However, they are trying to obscure the real reason behind our recurring winter flu crises. Since 2000, our population has increased by about 10 million, while the number of hospital beds has halved. This is the crux of the issue: mass immigration without a corresponding increase in public services. If we had as many hospital beds per capita as Germany, almost 8 beds for them, just over 2 for us, we wouldn't face winter flu crises. Our dedicated doctors and nurses will undoubtedly navigate this flu season as they always do, under immense pressure without any support from our ineffective politicians. Kudos to them. Meanwhile, brace yourself for even louder and more alarmist demands for mask wearing whenever we come near others. As we learned a few years ago, once freedom-restricting measures are implemented, it becomes much easier to enforce them repeatedly rather than addressing immigration or expanding healthcare infrastructure to accommodate our larger population. Please like, share and subscribe to my YouTube channel for more updates.